Good afternoon, everyone. It's my distinct honor and pleasure to welcome you all to the first meeting of the New Jersey Cannabis Regulatory Commission. I now call this meeting to order. Before we proceed with the notice of the meeting, I want to share with the public that the materials for today's meeting are available on the Commission's website at nj.gov/cannabis. Also, items 10 and 11 on the agenda are being considered together as one resolution, and item 12, the executive session, is being removed from today's agenda and will be considered for a future public meeting. Additionally, with respect to public comments, the Commission recognizes that there is significant interest from the public in the Commission's work, and in particular, the first actions that the Commission will take. As such, due to the organizational nature of this public meeting, public comments can be submitted to the Cannabis Regulatory Commission during and after the meeting in writing to mmp questions@doh.nj.gov. Again, that's mmp questions@doh.nj.gov. I believe we've already received about 50 responses to that email account. So we will make sure to make all comments submitted to this email address shared with the Commission members and available to the public. So with this meeting now in order, I will now take the roll. Commissioner Barker.
Present.
Commissioner Del Cid.
Present.
Commissioner Delgado.
Present.
Commissioner Nash.
Present.
And Chairwoman Waynu is present. We now have a quorum. Executive Director Brown, will you please read the notice of public meeting?
Good afternoon. Madam Chair, this is a regular meeting of the New Jersey Cannabis Regulatory Commission. Adequate notice of this meeting has been provided in accordance with the Senator Byron M. Bayer Open Public Meeting Act. There was a publication of the meeting time and location in 2 New Jersey print publications, the Trenton Times and the Star Ledger, on Saturday, April 10th, and the notice has been sent to the Secretary of State and posted on the public bulletin board outside the Secretary's office. Information regarding the virtual nature of the meeting due to the COVID-19 pandemic was posted in the publications and on the CRC MMP website. In addition, notice of said meeting has been and is being displayed on the websites of both the New Jersey Department of Health and the New Jersey Cannabis Regulatory Commission.
Thank you, Director Brown. Have all Commission members taken their oath of office?
They have.
Thank you. At this time, I'd like to take a moment to offer a few words before we dive into our agenda, and then allow my fellow commissioners to share their thoughts before the Commission begins taking its first actions. So I want to again welcome everyone who has joined us. I'm thrilled that we've finally arrived at this historic day, the inaugural public meeting of the New Jersey Cannabis Regulatory Commission. Our journey to this point is no small matter. It was a journey that included many faces from across the state, elected officials, stakeholders, advocates, and community organizers alike. And it ultimately included 2.7 million voters who changed our Constitution. But this journey started with the countless people with lived experiences who raised their voices and showed us all that our marijuana prohibition policies were actively harming individuals and communities. To each person who shared their story, I say thank you. It's because of you that we have reached this incredible moment in New Jersey's history. Today, the Cannabis Regulatory Commission officially begins. Now, standing up an entirely new state agency is no small task, but I'm grateful to everyone who made today possible. My fellow commissioners, Barker, Del Cid, Delgado, and Nash, our Executive Director, Jeff Brown, staff from the Department of Treasury, the Department of Health, Office of Information Technology, and the Attorney General's Office, and Governor Phil Murphy and his dedicated team. Starting today, the Commission's real work begins to establish and grow a responsible, regulated medical and personal use cannabis industry. By applying the values of safety and equity, we will center our work around creating and protecting patient access to medicine, promoting the production of safe products, and promoting diversity and inclusion in the industry to develop a national model for sensible, fair oversight. Now, this will take time. It will take us several weeks before we've developed procedures to guide our operations and hire full-time staff to help us move forward. But the Commission members and staff certainly won't be doing it alone. Just as we took a collective effort to get medical expansion and adult use legalization done, collaboration will be key to our future success. We'll continue working with government officials, communities and stakeholders, and people aspiring to become part of this industry so that we continue our journey and build a marketplace that people can have confidence in. I'm very humbled to be part of this journey, and I cannot wait to get to work. With that, the chair recognizes Commissioner Delgado to share his remarks.
Thank you, Chairwoman Waynu, and thank you for allowing me to share my story and make my comments. On July 20th, 1975, I, along with 3 friends, was arrested in New York State for the possession of marijuana while hitchhiking back to our summer camp jobs in the Catskill. We were handcuffed, placed in the back of a state trooper vehicle, taken to the local country judge's chambers located in the basement of his home, then processed to the Orange County Correctional Facility in Goshen, New York. I spent the next 4 days in a jail cell until my co-workers bailed me out. Now, I share this story with the public and my fellow commissioners because when I think about what led me to accept this position on the Cannabis Regulatory Commission, this incident from 46 years ago was very much on my mind. I did not ask, nor did I lobby for this job. I was happily retired, busy volunteering at my local YMCA, the New Jersey Regional American Red Cross, and serving on the Board of Trustees at Felician University. But when Speaker Coughlin called and informed me that he was nominating me for the Cannabis Regulatory Commission, I thought I could offer leadership, business experience, and diversity, and a historical perspective of how much we've progressed since 1975. The values I bring to this commission are one of a lifetime of hard work, perseverance, and accomplishing goals. First, let me start by saying that English is not my first language. I was born in Aguadilla, Puerto Rico, and as a young child, I made it my imperative to overcome language barriers. During my 53 years of work, I've been a paper boy, a cab driver, a military officer, a business owner, and a corporate executive. During the last 13 years as a Verizon executive, I am proud knowing that in my sometimes simultaneous role as a foundation and external affairs leader, I had a positive impact on New Jersey communities, businesses, as well as individual lives. I bring to this commission the understanding that the ability to support an organization in achieving its goals and objectives is really dependent upon building a solid and trusting relationship between stakeholders and communities it serves, particularly diverse communities, businesses, local and state government leaders. Let me make it clear, we will create a fair, inclusive, entrepreneurial, and exceptional adult use market, but we will not do that at the expense of the needs of the New Jersey medical cannabis patients. We're all here today based on the bedrock of understanding that patient needs are and will remain a top priority for this commission. We will continue the work of the Department of Health in working with the industry to enhance supply, quality, and accessibility of medical cannabis to our state's current and future medical cannabis patients. Let me say I come here today ready to work for the interests of the people of New Jersey, to be communicative, transparent, and responsive to the needs of my fellow commissioners, patients, consumers, businesses, and other stakeholders, as together we built a legal cannabis industry and marketplace. I welcome the challenge of being part of an authority charged with creating a responsible, safe, and consumer-protected environment for the medical and personal use of cannabis while balancing the needs of business owners, and workers. This will not be an easy road to travel. There will be many competing interests and much is on the line. But with determination and common sense, especially common sense, this commission will develop a successful, transparent, and equitable regulatory model for both consumers and the marketplace. I want you to know that I value honesty and transparency and that my door is always open. I will weigh the facts and consider the circumstances before making any decisions. Through my life experiences, I've learned that the best practices are to be prudent, straightforward, and practical. You will always be treated with honesty and respect and courtesy. I only expect that you do the same in return. I want to close by thanking Governor Murphy and Speaker Coughlin for putting their trust in me. I want to acknowledge Chairwoman N.J.S.A and Executive Director Jeff Brown for their hard work in guiding this commission to where we are today. It has not been easy. Diane, Jeff, I thank you for your stick-to-itiveness and leadership. Thank you. Finally, I also want to acknowledge my fellow commissioners, Krista Nash, Maria Del Cid, and Charles Barker. Krista, Maria, and Charles, I look forward to our collaboration. Thank you very much. I turn it over back to you, Chairwoman Wainu.
Thank you, Commissioner Delgado. The chair now recognizes Commissioner Nash to share her remarks.
Thank you, Madam Chair. Hello, everyone. Thank you for joining us today. My name is Krista Nash, and I am honored to be a part of this commission. I would like to start by thanking Senate President Sweeney for selecting me as his appointment to the commission. Thank you, Senate President. I would also like to thank Chairwoman Diana Wainu and Executive Director Jeff Brown for their work and support. I look forward to working with them and my colleagues on the commission. I come to this commission with the perspective of a licensed social worker in the state of New Jersey. Social work is not only my vocation, it is my passion. I became a social worker because I have always been a passionate social advocate for social justice and wanted to effect change. I believe that one of the core values of social work is social justice. My interest in serving on this commission was driven by my desire to make a broad impact on large-scale social issues like socioeconomic inequalities or injustices within the criminal justice system. Social workers pursue social change, particularly with and on behalf of vulnerable and oppressed individuals and groups of people. We strive to ensure access to services, information, and resources, equality of opportunity, and meaningful participation in decision-making for all people. It is from that professional lens that I approach my work on this commission. I also believe that my work in the field of reentry gives me a unique understanding and perspective on certain issues. I recently served as the program director for a reentry program in Camden, New Jersey. The program helped returning citizens with co-occurring disorders transition safely back to the community. These are men and women who have been directly impacted by the war on drugs. Sadly, I was a witness to the numerous barriers they faced as they tried to reintegrate back to the community. And I plan to use my social work values and understanding of these issues to guide my work with the commission. And that work not only includes issues concerning recreational cannabis, but also ensuring that the growing number of medical marijuana patients continue to have an adequate supply of marijuana for medicinal use without disruption to the supply. Again, I'm thankful for this opportunity. I look forward to public participation, and I'm ready to work hard for all residents of New Jersey. Thank you.
Thank you, Commissioner Nash. The chair now recognizes Commissioner Barker to share his remarks.
Thank you, Madam Chairwoman, Director Brown, fellow commissioners, and the general public joining us today. For several decades now, Black and brown individuals, as well as their families and communities, have been vilified through the government-created war on drugs. These targeted efforts were aimed at, among other things, disrupting the unity of Black communities and like-minded allies in the fight for justice and equality. Sadly, these government-sanctioned tactics brought brutal consequences, devastating mothers, fathers, brothers, sisters, families, and entire neighborhoods in some areas. On top of that, zero-tolerance law enforcement actions mercilessly criminalize people who are set up to fail through the disproportionately unfair justice system. In the same way that the war on drugs, also known as the war on people, created policies primarily targeted at Black and brown communities for their destruction, it is humbling to be in a position to create policies and regulations primarily focused on restoring these same communities. As I think about our work here on the Commission, I think about the chance to rebuild targeted communities, about the opportunity to generate wealth in these same neighborhoods through access, at early stages no less, to one of the biggest industries of the future here in New Jersey and throughout our country. Hopefully, we will do our part to create rules and regulations that make New Jersey a model state by prioritizing restorative justice, safety, and equity, along with other critical components. I get excited when I think about the ability to expand on our medical cannabis program to ensure, as Commissioner Delgado said, that patients are prioritized throughout the process. They have specific needs that cannot be overlooked nor taken lightly, and that will also guide my focus. I am confident that the experiences and knowledge that I have learned up to this point have prepared me to carry out the duties of this position. I look forward to working with and learning from everyday citizens, community groups, stakeholders, elected officials, government agencies, and other interested parties in our great state and beyond. Thank you again for this opportunity, and I look forward to the work before us on behalf of the people. Thank you, Madam Chairwoman.
Thank you, Commissioner Barker. The chair now recognizes Commissioner Del Cid Coso to share her remarks.
Thank you, Madam Chair. Today is a historic day for New Jersey, as it marks the official start of the Cannabis Regulatory Commission. It took many years for this day to come, and we couldn't have done it without the support from the advocates, our partners in the legislature, and Governor Murphy's leadership. On February 25th, New Jersey became the 13th state to legalize cannabis. And as you may all remember, last November, 67% of registered voters said yes to legalization. As a young Latina who comes from humble beginnings, I am thankful to Governor Murphy for giving me the opportunity to serve the residents of New Jersey as the CRC Commissioner. For me, it is critical that we ensure that this new potentially multi-billion-dollar industry is carried forward equitably. I plan to use my professional and personal experience to ensure that our marginalized communities, Black and brown, women, and veterans have a voice in the process. Cannabis is not new, but many of our brothers and sisters have been affected by the war on drugs, social injustices, and racism in our criminal justice system for far too long. According to the ACLU, Black people are 3.5 times more likely to be arrested for marijuana possession than whites. We cannot allow these injustices to persist as we build this new industry. As the former Director of Policy and Legislative Services at the New Jersey Department of Health, I work closely with the medical marijuana program. While we have made tremendous progress over the last few years, including providing home delivery for patients, promoting transparency in pricing, and changing the caregiver rules, our work here is not done. There are a lot of lessons learned from the medical program, and I am optimistic that we will continue to improve the consumer's experience and access, and that we're going to be able to apply some of those lessons as we stand up the recreational market. And because this commission will regulate both the medical and the recreational cannabis, I look forward to continuing to advocate for patients. Last but not least, I look forward to working with our partners and stakeholders throughout the state to ensure that we do this fairly and safely. And that when we look back 5 to 10 years from now, we are able to proudly identify why and how New Jersey became the leading state in the cannabis industry. Thank you. For the Spanish speakers listening to us today, I would like to share a few words. Para mi comunidad que nos está escuchando el día de hoy, quiero compartir con ustedes una de mis prioridades para la Comisión Reguladora del Cannabis. Es muy importante para mí que las comunidades marginadas como las mujeres, nuestros veteranos y las comunidades minorías sean representados en este proceso. El cannabis no es nuevo en nuestras vidas. Antes de la legalización, muchos de nuestros hermanos y hermanas se vieron afectados por la guerra contra las drogas, las injusticias sociales y el racismo. Por eso es muy importante que los objetivos de esta comisión se lleven a cabo con una perspectiva equitativa. Gracias y espero trabajar con ustedes para garantizar que hagamos todo esto de una manera justa y segura. Thank you, Madam Chair.
Thank you, Commissioner Del Cid. We'll now turn to our first item of business, election of the Vice Chair. Nominations are now in order for the office of Vice Chair. Do I have any nominations?
Madam Chairwoman, I nominate Commissioner Sam Delgado for the position of Vice Chair.
Thank you, Commissioner Nash. Commissioner Delgado is duly nominated. Are there any further nominations for Vice Chair? Hearing none, the nominations are now closed. The chair recognizes Commissioner Delgado for remarks before we proceed to voting.
Commissioner Delgado, you are muted.
Well, thanks a lot, Director Brown. Thank you, Madam Chairwoman. I just want to thank my fellow commissioners and yourself for your confidence in electing me as Vice Chair. With that, as Vice Chair, I will strive to ensure that this commission runs and operates with the same level of professionalism, diligence, and commitment that we expect from our industry operators. Again, thank you very much.
Thank you, Commissioner Delgado. There being no other nominations for Vice Chair, Director Brown, would you please take the roll call vote?
Under consideration is the motion to elect Commissioner Sam Delgado as Vice Chair of the Cannabis Regulatory Commission. Commissioner Barker.
Aye.
Commissioner Del Cid.
Aye.
Commissioner Delgado.
Aye.
Commissioner Nash.
Aye.
Chairwoman Wainu.
Aye.
The motion passes.
Congratulations, Mr. Vice Chair.
Thank you.
Our next order of business is the transfer of authority from the Department of Health to the Cannabis Regulatory Commission for activities pursuant to the J. Koenig Compassionate Use Medical Cannabis Act. This concerns Resolution 2021-2. Pursuant to the Act, all 5 commissioners must be appointed and present at a meeting, and a majority must vote to transfer authority. Director Brown, can you please confirm for our record that all 5 commissioners have been appointed and sworn in and are present?
Madam Chair, all 5 commissioners have been appointed and sworn in and are present.
Thank you. For the benefit of members of the public who are watching this meeting virtually, I'll briefly summarize the resolution. Currently, the regulation and enforcement of activities related to medical cannabis are done by the Division of Medical Marijuana in the New Jersey Department of Health. As the laws authorize the Cannabis Regulatory Commission to regulate and enforce activities related to both medical cannabis and personal use cannabis, the laws specify that the Commission must formally transfer the Department of Health's authority with respect to medical cannabis to the Commission, which will allow the Commission to then exercise powers over the existing medical cannabis industry going forward. I want to pause here and recognize the weight of this resolution. From Governor Murphy's 6th executive order as governor to the signing of 2 historic legislative packages over the past 2 years, this decision marks yet another milestone in New Jersey's journey to reform and expand access to medical cannabis and the duty to create a safe and equitable marketplace for cannabis for adults over the age of 21. A decision to transfer authority over to the Commission brings with it the responsibility for more than 100,000 patients who have been helped by cannabis, and the responsibility for more than to continue protecting those patients' access to medical cannabis. To the patients and advocates who fought so admirably to establish and expand the medical program, I say this: we will not fail you. With that, it is with great honor, duty, and humility that I ask for a motion to adopt Resolution 2021-2 to transfer authority for the regulation of medical cannabis from the Department of Health to the Cannabis Regulatory Commission.
So moved, Madam.
It's been moved by Commissioner Del-Cid and seconded by Commissioner Nash. Is there any discussion on the resolution? Hearing none, Director Brown, can you please call the vote?
Under consideration is the motion to adopt Resolution 2021-2 to transfer authority for the regulation of medical cannabis from the Department of Health to the Cannabis Regulatory Commission. Commissioner Barker.
Aye.
Commissioner Del-Cid.
Aye.
Commissioner Delgado.
Yes.
Commissioner Nash.
Aye.
Chairwoman Wainu.
Aye.
The resolution passes.
Thank you, Director Brown. Next on the agenda is the approval of the annual meeting schedule for the rest of calendar year 2021. The proposed meeting agenda is displayed on the screen currently. Do I hear a motion to adopt Resolution 2021-3 concerning the annual meeting schedule?
So moved.
I second the motion.
So the resolution has been moved by Commissioner Barker, seconded by Commissioner Delgado. Is there any discussion? Commissioner Barker?
Yes, Madam Chairwoman. I recognize the value of letting the public know as early as possible what the regular meeting dates of the commission will be. And given that this is our first meeting, I'd like for us, if we can, to postpone consideration of the annual meeting schedule as the currently proposed times, 10:30 primarily. They may be too early for many people to join. And so in order for the commission members to consider holding meetings at a time where a greater share of the public may be available, I move to postpone consideration of Resolution 2021-3 concerning the annual regular meeting schedule to the next commission meeting.
I agree with Commissioner Barker, and I second that motion.
Thank you, and well said, Commissioner Barker. So we now have a motion and second to postpone the consideration of Resolution 2021-3 concerning the regular meeting schedule until the Commission's next meeting. Any further discussion on this motion to postpone the consideration of the resolution? Hearing no further discussion, just Director Brown, could you please do a roll call vote?
Under consideration is the motion to postpone Resolution 2021-3 concerning the annual meeting schedule until the Commission's next meeting. Commissioner Barker.
Aye.
Commissioner Del Cid.
Aye.
Commissioner Delgado.
Aye.
Commissioner Nash.
Aye.
Chairwoman Wainu.
Aye.
The motion passes. Thank you.
All right. Next, we have the Executive Director's report. So Director Brown, I'll turn it over to you.
Thank you, Madam Chair, and good afternoon, everybody. I wanted to start off and just say a couple things on the transfer of authority that was just passed by this commission. The Department of Health and the staff members here, many of whom will hopefully be transferring over to us at the Cannabis Regulatory Commission to continue the work that we've done at DOH under the CRC, have done, in the past, an absolutely tremendous job for this program, and I can't say enough good things about the almost 30 individuals who we have working for us. Whether they be field compliance and investigations, customer service, or our wonderful technology team. You all have really made the success of this program possible, and really are setting the stage for continued success at the New Jersey Cannabis Regulatory Commission. So I wanted to start there. So to provide you all with a bit of a snapshot of where we are in the medical cannabis program now under the CRC, we are over 106,000 patients currently enrolled, close to 107,000 at this point, over 4,000 caregivers. We have over 1,250 participating healthcare practitioners. 16 almost operational dispensaries. There's one that is on the cusp of getting their permit. So we're at 15 open, 16 operational. And then at any given time, we have roughly 20,000 pounds of cannabis and cannabis products in aggregate in inventories across the state. A couple years ago, we did a biennial report where we looked at the needs in the market. We found that as and this should be common sense, as we enroll more patients, we need more capacity to grow cannabis, to process it, and ultimately sell it to dispense it to patients. We are in the process of updating that. That's one of the things that the commission will inherit. We are in the process of doing another biennial report and looking at needs in the market and what we need to continue to serve this patient population, especially given that we are on the cusp of broader legalized sales. And as all of you noted in your remarks, the need to protect patients and protect access to patients it comes first and foremost. The call to action from our last biennial report was threefold. We need lower prices and better value for patients. We continue to work on that, and there's a lot more to do. We also need more accessible locations, more dispensaries. And in that vein, more ATCs are needed, specifically those committed to operating in a more competitive market. The good news is that the two historic laws signed by Governor Murphy over the last couple years lay the framework for the work ahead. Our charge is twofold: protect, expand, and improve access to medical cannabis, and create a safe and equitable market for the production and sale of cannabis to adults over the age of 21. So how do we get there? We are transferring from the Department of Health. We have a wonderful staff who are committed to doing a great job and do so, but we really need to expand. And really our success is going to be achieved through three main areas. Number one is staffing and infrastructure. We're going to vote on a plan of organization today, which is going to enable us to go out and start to hire the staff we need to be successful. Infrastructure. There are systems that are required by law. There are systems that will be required by necessity for us to get and utilize at the CRC. We need to put these things in place so that we can be successful down the line. The legal industry, as well as the expanded medical industry, come down to regulations, and we have our work cut out for us on that front. I'll talk a little bit more about that in a second. But regulations are going to provide the framework for ultimately the permitting and licensing of new businesses. So first, staffing and infrastructure, then regulations, and then we get to permitting and licensing of new businesses. We do have some challenges. So there's uneven readiness and action in our current cannabis industry. There are some of our alternative treatment centers who are, moving full speed ahead, and others are not. And, in order to launch a legal market on the backbones of our current industry, we would really need to see action across the board. There's a rulemaking timeline and process. The normal rulemaking process can take, in the best case scenario, 5 months. Thankfully, the legislature has imparted to us some authorities that enable us to speed that up, which we will try to do. But nonetheless, the rules will be comprehensive, and they will need to, we'll need to get educated, and we'll need to move on those quickly given the deadlines that are in the statute. We have limits on the number of cultivators that we can issue licenses for in the first 2 years. It's 37. So basically we start there and then we build out beyond that. I did want to note that we also see a growing prevalence of municipal bans. The thing I want to say there is that a municipal ban doesn't necessarily ban cannabis from that municipality. It just bans our ability to regulate an industry there. So, I would encourage all municipalities to just, work with us, wait to see the regulations that we do before making a decision on which way you want to go. Certainly, we want to hear from all of you on your, your concerns and the issues that you're facing with your constituents. But it's going to be important that these businesses have a place to go and have a place to set up. There are reasons for optimism. First and foremost, we are taking over an ongoing process related to a 2019 request for applications. That means that as that process concludes, we'll be able to get new permitted entities into the medical market sooner rather than later. Both Jay Koenig's law and the legalization law signed by Governor Murphy earlier this year call for a dramatically different and more open permitting and licensing process in the future. They both incentivize the permitting and licensing of what are called micro businesses and conditional permits and licenses. Micro businesses are going to be smaller businesses under 10 employees with limits on the amount of cultivation space they can have or the amount of volume they can move as far as sales. And conditional permits are a mechanism to allow entrepreneurs who are just starting a business to get an initial okay from the commission while they work on a larger full permit application. We also have to look forward to regional collaboration. I know there's a lot of talk about New York, New Jersey, who's going to get there first. And, I just want to note that whether it's New York or Pennsylvania or Maryland or any other states up and down the eastern seaboard here, we look forward to working collaboratively with regulators in these other states, and we are members of a association, and we are going to rely on doing this together. We're going to rely on best practices, whether they come from Oregon or Colorado or New York or New Jersey. So with that, thank you all. It's a great honor to be here. Thank you. Thank you, Madam Chair. Thank you, Commissioners. It's with great honor that we now move on to officially start this work.
Thank you, Director Brown. And yes, as it pertains to the regional collaboration, I do agree with you that collaboration is going to be a key for this region's overall success. But to our friends across the river, I will say that we in the Garden State will be living up to our name as the Garden State. So our next order of business is Resolution 2021-4, concerning the plan of organization for the Commission pursuant to the New Jersey Cannabis Regulatory Enforcement Assistance and Marketplace Modernization Act. The Commission shall establish and from time to time alter a plan of organization and employ personnel as it deems necessary under the direct supervision of a full-time executive director for the Commission. The Commission of Organization shall also include, under the statute, an Office of Minority, Disabled Veterans, and Women Cannabis Business Development. So with that, Director Brown, can you please provide the commission with an overview of your proposed plan of organization?
Absolutely. Before you all is the proposed plan of organization for the Cannabis Regulatory Commission. This plan establishes several offices, including the statutorily required Office of Minority, Disabled Veterans, and Women Cannabis Business Development, here given the functional title of the Office of Diversity and Inclusion. The other offices include the Office of the Executive Director, the Office of Data and Business Analytics, the Office of Compliance and Licensing, and the Office of Patient and Customer Services. Together, this organizational structure will allow us to build a modern agency that has robust licensing and compliance resources, backed up by data-driven decision-making and project management, and an intense focus on weaving equity through everything we do. Proper staffing and infrastructure will be critical to our success, and this plan of organization will allow us to move full speed ahead with building out the CRC.
All right, thank you. Also included in this resolution is the adoption of the official Cannabis Regulatory Commission's logo. Do I have a motion to adopt Resolution 2021-4 concerning the plan of organization and the logo?
So moved.
Thank you, Commissioner Nash. Do I have a second?
Second.
Commissioner Del Cid, thank you for that. Is there any discussion on the resolution? Hearing none, Director Brown, can you please call the vote?
Under consideration is the motion to adopt Resolution 2021-4 to adopt the Commission's plan of organization and logo. Commissioner Barker.
Aye.
Commissioner Del Cid.
Aye.
Commissioner Delgado.
Aye.
Commissioner Nash.
Aye.
Madam Chair.
Aye.
Resolution passes.
Thank you. As I stated earlier, we're going to defer the executive session to our next meeting. With that, is there any further new business to consider? Hearing none, this concludes the business before us for the day. Do I have a motion to adjourn?
So moved.
I second that.
Moved by Commissioner Barker, seconded by Commissioner Delgado. All those in favor say aye. Aye.
Aye.
All those opposed say nay. Any abstentions? All right, the ayes have it. So I want to again thank everybody for joining us on this historic afternoon. Our next commission meeting will be on Thursday, April 22nd. The meeting details will be shared later this week. Given the ongoing pandemic, that meeting will also be conducted virtually. An agenda and materials for that meeting will be posted on the Commission's website as well. So we are now adjourned. Thank you, everybody.
Thanks, everyone.
Thank
Have
you.
a good afternoon.
Thank you all. Take care.
Thank you.